Getting ready. The PPE that is required for strict isolation includes gloves, gown, face shield or goggles, and an N95 respirator that has been fit tested within the past year. When wearing a gown as part of isolation precautions, it is best practice to remove lab coats or other extra items of clothing, such as sweaters or fleece jackets or vests. There are two reasons for this. First, wearing gown, gloves, respirator, and face shield can be warm. Having additional clothing underneath can make that worse. Second, long sleeves, knit cuffs, and other bulky clothing can make it difficult to doff your gown with contaminating this clothing. Another best practice is making sure that your hair is secured and out of the way, as you should not touch your hair while in PPE. The final step before donning PPE is, if you have a stethoscope, remove it from around your neck and leave it outside the room. There will be a dedicated stethoscope in the room. Now we will demonstrate donning PPE for strict isolation. The first step when donning PPE is to perform hand hygiene with alcohol-based hand rub. The second step is to don your gown. The gown is a disposable gown with a closed back and one tie at the waist. Unfold the gown and put arms through sleeves from the back of the gown. Pull the gown over your head and straighten out the gown. Slide thumbs into thumb hooks. Waist ties are attached at the hip on both sides. Tie waist ties behind the back. The next item of PPE to be donned is your N95 respirator. You must have been fit tested within the past year, and you need to know the brand or type and size you were fitted for. The following instructions are for the 3M N95 respirator, which is the most commonly used at MGH. Cup the respirator in your hand, allowing head straps to hang freely. Position respirator under your chin with the nose piece up. While holding the respirator in place, place the top strap over your head so it rests high on the back of your head. Continue to hold the respirator firmly in place and pull the bottom strap over your head and position it around your neck below your ears. Untwist the straps if needed. Position the respirator low on your nose. Using both hands, mold the nose piece to the shape of your nose by pushing inward while moving your fingertips down both sides of the nose piece. Remember, don't pinch the nose piece. Each time an N95 respirator mask is worn, you must perform what is called a seal check or a fit check to ensure there are no air leaks around the mask. To perform the seal check or fit check, place both hands completely over the respirator. Careful not to disturb the position. Inhale sharply. You should feel the mask suck inward. Exhale sharply and see if air leaks around the edges. It should not. If air leaks around the nose, readjust the nose piece. If air leaks around the edges, adjust the straps. If you are unable to achieve a proper fit, notify your supervisor. Once your respirator is in place, the next element of PPE to put on is a face shield or goggles. Either is acceptable PPE to protect your eyes from splash. A face shield is donned by placing the foam strip against your forehead and tightening the strap around the back of your head. The shield should cover your face with the bottom of the shield at the level of your chin. Goggles are put on just as you would wear a pair of glasses. If you wear glasses, they are not considered protective. Please wear a face shield or goggles over your glasses. The final step in donning PPE for strict isolation is putting on gloves. Thumbs should be in thumb loops. Gloves should be donned and pulled up over the cuffs of the gown. You are now ready to enter the strict isolation patient room.